Hey guys, it's Dr. Leah from Body and Balance, and today I really wanted to talk to you about one of the things that you can do to really take control of your diabetes. And one of those things I want you to really push for is getting more advanced blood work. When Dr. Scott and I really analyze blood work in our clinic, not only do we look at factors like what your basic fasting glucose is, but we also look at things like hemoglobin A1C that actually measures your blood sugar over about a 3-month time period. But we also like to get other factors. I actually like to see what your fasting insulin is. So what you can imagine is that if you are on the verge of getting diabetes, your body is pumping out insulin like crazy in order to keep your blood sugar level more stable. Well, if we can detect that early enough, we can see how quickly someone is approaching diabetes and really shift their whole lifestyle and their diet to change that. But really push to get that fasting insulin value because it gives us a ton of information about how quickly you're headed towards diabetes. Or if you do have diabetes, gosh, what are the numbers actually looking like in a whole picture? The other factors I really like to see for our patients are things like homocysteine as well as hsCRP. Those two values actually show us, one, and with homocysteine, how much inflammation is in the vascular system of the body. But also, and I guess that one also shows us how well your body is detoxing itself, methylating. But the second factor that we're looking at is hsCRP, which shows us how much inflammation is in the cardiovascular system. I want you to push to get those values, and if you can't, you can always come see Dr. Scott and I, and if it's clinically appropriate, we can order that lab work. But those values actually show us how healthy your body is. If you have a lot of inflammation in the vascular system, as well as in the heart, gosh, the whole picture of diabetes and how diabetes actually increases the risk for heart disease is not looking good. And we need to take drastic action and formulate a plan for that patient in order to get them well on a rapid track. We want to shift the whole path of that patient's physiology, but really push to get that information because those values are really key in evaluating what's truly happening with a patient. So that's another thing you can do if you're worried about diabetes, you're pre-diabetic, or you're dealing with diabetes. We want that information, and it can give us a whole new picture of what's happening with your health. So I hope that information is helpful. Please like our page so you can get more of these videos and more information. Have a great day, and we'll see you next time.